anxiety. There is nothing to be worried about. Everything is under control. And that is why I stated very clearly in my statement that there is no restriction to travel, to trade, to tourism. And there will be no lockdowns. Because this is a preventable disease, it is manageable. And we can all manage it together. The international health regulations that was amended recently, I think this was May this year, clearly states that even in the event of outbreaks or pandemics, there should be no restriction to travels. So nobody is going to restrict the truck drivers. We need them to move and carry goods to the various neighboring countries. We only want to provide information to them to protect themselves. And that is what is important, because they need to know if I wash my hands, if I use sanitizers, if I don't go with people that I don't know, somebody may be in the prodromal syndrome with mouth sores and so on, I will not get mpox. We need to disseminate the information widely, and that is what we are doing, so that we can prevent, and prevent. Now, when all of you spread the right information about the modes of transmission and how to prevent, then mpox will not spread. And that is what we need to know. Now, it was absolutely right for the African CDC to deliver vaccines to DRC. That is the epicenter. And DRC has the largest numbers of infected people. So if you prevent at source, then you will prevent the spread. Many of our countries, for example, in Uganda, so far we have only reported 10 cases. You can't compare Uganda with the DRC. And these 10 cases, some have already improved, over 4 cases. The people taking care of them are doing a good job. Now, the vaccine is for prevention. And Uganda has already been offered 2,000 doses. It has been offered, but the vaccine has to undergo systems in Uganda, because the World Health Organization is still looking at the documents, preparing whether to consider it for emergency use listing. Remember, even when WHO does that, in country, we have to do a similar thing. Consider it, look at literature, whatever is available, perhaps even do some tests. So NDA has to do its work. The National Immunization Technical Advisory Group also have to do their work. What if they say, no, in Uganda we don't need? Then we have to listen to them as well. So African CDC will not bring the vaccine until the systems in Uganda have concluded and are ready to receive the vaccines. And I think that answers his question as well, because I clearly stated that as the various organs in the country are doing their work, we are also drawing up our plan on whom to consider for the vaccine. And the consideration will be for those that are most at risk. But it will follow the districts, mainly the districts that border the DRC, because they will be most at risk. So when you ask that when do we expect the vaccine will come. I can't give you a date. Let the organs, the different institutions finish their work, and the vaccines will come. Yes, children are going back to school. Are we worried? No. And we are not going to close schools. That is not necessary. Children have to go back and study. What is necessary, what is critical, what is vital is that we all understand how to prevent. And that information will be given to all the schools to prevent. I mean, avoiding contact. Now, if there is no infectious person going into the schools, then where will the schools get it from? All we need to